The PACE-A trial compared radical prostatectomy with stereotactic body radiotherapy in men with low to intermediate risk localized prostate cancer. This phase 3 open-label randomized trial aimed to provide level 1 evidence on patient-reported outcomes, focusing on urinary, bowel, and sexual functions at 2 years post-treatment. 123 men were randomized 1-to-1 to either prostatectomy or SBRT. At 24 months, 32 prostatectomy and 46 SBRT patients were included in the final analysis, with a pro-completion rate of 67%. Outcomes assessed included urinary pad use, EPIC-26, IPSS, and IIEF-5 questionnaires. Firstly, looking at the urinary symptoms, of the 32 prostatectomy patients analyzed, 16, i.e. 50%, reported a pad use at 24 months, with 15 patients using 1 pad daily and 1 using 3 or more pads daily. In contrast, 3 of 46 SBRT patients, which corresponds to 6.5%, reported a pad use, with 2 using 1 pad daily and 1 using 2 pads daily. The median urinary incontinence score was 77 for prostatectomy compared to 100 for SBRT, even though there was no evidence of a difference in overall urinary bother. Regarding bowel symptoms at 24 months, the median EPIC bowel score was 100 for prostatectomy and 87.5 for SBRT, with a mean difference of 8.9. Declines beyond the minimal clinically important difference were observed in 45% of patients with the SBRT versus 14% of patients in the prostatectomy arm. Finally, looking at the sexual function, prostatectomy patients reported a median EPIC sexual score of 18, significantly lower than the 62.5 observed for SBRT. Clinically meaningful declines in sexual function were seen in 75% of prostatectomy patients compared to 48% in SBRT patients. The proportions of men reporting moderate to severe problems with overall sexual bother were 33% with the prostatectomy and 18% with SBRT. To conclude, SBRT led to better urinary continence and sexual function, but worse bowel outcomes compared to prostatectomy. Compared to other studies like PROTECT and PIVOT, pad use was higher in PACE-A, likely due to use of security pads. Moreover, bowel outcomes may improve with SBRT by using perirectal spacers. Clinician-reported outcomes differed from patient-reported data, indicating possible underreporting of symptoms. Limitations include a small sample size, early study closure and a 2-year follow-up, and a 67% PRO return rate.